the only way you can create equity is to bring in a percentage. So when we worked all the averages, then we averaged it to 2.5. All the total receipts, that is what would bring 2.75%.
Okay.
And it actually reduced what the people below 35,000 were paying.
So, like we said, we just came to terms with the provisions of the finance bill after it was signed into law, and then we now got confirmation that the next frontier would be NHIF, having those rates at 2.75% of income, also for individuals who are not employed or the vulnerable. That was also increased from, the proposal is to increase it from 500 shillings to 1,000 shillings. But I believe they've walked back on that, because even when I had the NHIF acting CEO on my show on Tuesday, he said that is something that has been done away with. So again, another possible hit on payslips. Sam, I almost used the nickname. But I don't think we're ready to introduce Kenyans to that. But that just almost came out of my mouth. But here it is. So more being loaded on the payslip. So what does that look like now?
In the hope to see a doctor.
Yeah. So, I mean, whatever it is, don't get sick in this country, clearly.
Yeah. So it is quite something. And when you look at the figures, it sounds like it's just a percentage, 2.75%. But when you calculate and then you reflect on the incomes that Kenyans make, whether it's the average of just about 20,000 shillings in the country, or it's majority who earn below 50,000 shillings, it is significant, because you know what that money can do. But more of concern is, yes, you'll get the 2.75% if this is approved, knowing that these are regulations, so they don't require a lot of lawmaking. They will not go to the first reading, second committee stage or everything. Because regulations, it's the implementing authority in consultation with the cabinet secretary that come up with those regulations. Then they are subjected to public participation, and eventually they're supposed now to be embraced by parliament. So it is significant, but the other question that many have been asking is about what are we getting at the moment? What's the value of the much you contribute? At a maximum of 1,700 shillings, what is it that you're getting? You go to hospitals and the NHIF can only pay for bed, and that bed is, right now it's 2,000 shillings per night. So reflect on that versus the services that you're looking for, the inefficiencies in the system, and especially when you're trying to get a service, whether it's at a public hospital or private hospital. Majority of the private hospitals do not really accept the NHIF cards, bearing in mind of the challenges that have been going on in that sector. But also the bigger question, I was speaking to a doctor early in the week and telling you the challenges that exist. You go to a hospital, some will accept to take the cards, some will not. But then again, even after the hospitals have attended to patients, how long does it take for them to get the claims that they make to NHIF? And you realize that certain hospitals have actually been taking advantage and corrupting their way to the NHIF. You go to some offices, both at the NHIF but also in government services, and you find that people are asking for kickbacks for certain things. You look at the lifestyle of some of the officials within the NHIF. Their lifestyle is beyond the sort of income they make. So it appears that a lot of people haven't reached themselves. I heard the chairperson of the NHIF, that is Engineer Kamau, saying that fighting corruption is a daily thing. It is a 365-day thing. So continuously, even as Kenyans battle what eventuality may befall them, should these regulations be approved and therefore applicable, what value are they getting from the NHIF? Yeah,
the CEO sat with me on Tuesday, and he did talk about some enhanced access with maternity, with cancer treatment, and a number of other services that are provided under NHIF. If this proposal sails through and they're able to get more money. But I think the question has always been, does NHIF need more money or does it need better management of the money that they currently have? There have been many of those issues, fraudulent issues of claims, including that story we ran just not more than a month ago, actually, it was last week, about collusion between some hospital officials and NHIF officials. So there's collusion on both sides of that divide. There have been previous cases of up to 10 billion shillings in false claims. 10 billion, huh? Not 10 million, not one, but 10 billion with a B. And for many Kenyans, for this, just like with everything else, it is a trust issue. What have you done with the little that we have been giving you? And therefore, how can we trust that when we give you more, that you will handle it well? The NHIF board chair did talk about some of the issues that have been raised. So I want us to listen to that fifth soundbite where he, did acknowledge the issues that exist, but that they are doing something about it.
It's not lost to me that NHIF has serious problems in terms of fraud. We cannot wish them away. And I told you it is percolates from hospitals. I would name a hospital here, one of the big hospitals in Nairobi.
Which one?
No. We are on air. There is no
These
point.
These are facts, right?
No. I didn't come here to point names. But I tell you, you are paying NHIF and you have private insurance and they make double claims.
Yeah, I mean, he's right. It's from the top to the bottom. And like you said, Sam, he did mention the fact that, fighting corruption is a daily thing. But, you also need to see some of the results of that fight against corruption.
Exactly, right? Yvonne, because we've been at this point, not this exact one, but something close to this in the past, where promises have been made about how public money will be utilized better, how we'll bring corruption suspects to book, how we'll do this and that, we'll have structures in place, we'll strengthen our security bodies, all those things, our judiciary,
digital measures,
all those promises have been made in the past, and they've sadly been broken. People worry about how their hard-earned cash would go into people's pockets, and it will not translate to them getting any service. It will be great, Yvonne, if those add-ons that they're talking about for cancer patients and for maternity actually end up being a reality. When Nimrod did the feature last year about cancer and how people are dying from it, and most of them are because of being unable to afford the cost, the drugs that they need, the chemotherapy, the radiation they need, and a lot of them actually had been diagnosed with the disease early on. And they had to go back, try and find money for treatment. And then by the time they come back, the disease has progressed to stage 3, stage 4, and then hope for survival dwindles.
Yeah.
Because if we're able to assure people and we actually see that this is going to work, I mean, hey, people, no one would object to this. But the fact that in the past nothing has worked, the fact that in the past hard-earned money has gone down the drain, makes people very skeptical about what will be different this time around. You are cutting so much money out of someone's payslip. I think with all the deductions, Gituku, if I'm not wrong, there are some workers who will be handing over about 40% of their monthly salaries to the government. There are countries where people pay 40% of their salary to the government or even more, but they see their taxes working for them, from healthcare to education to infrastructure to transport, and you actually don't feel the pinch so much because they're like, this is my money is working for me. But will the money that is being deducted really end up working for you?
Yeah, and I think just to pick up on that, I mean, the issue is that it does feel like it's an assault, right? You get used to this one, you get up, and then, there's another one, and it's all being loaded really, literally on the same one. I want us to listen to university union officials who, I think we're just lamenting on this issue about what this means. I think most people are happy to pay more to NHIF if it means they will get more money. They're happy to pay more taxes if it means they will get more services. But it's just coming at a really difficult time. So don't forget that even before the COVID-19 pandemic, we were struggling for sure. The country was not where it should have been. And then you have the COVID-19 pandemic, there's layoffs, there's pay cuts, and now just starting to get over it. And yes, tough decisions must be made, but also how the Kenyans, who are the taxpayers, are feeling must also be taken into consideration. Let's listen to the UWASU officials.
Can allow this taxation to take place as workers if we have increments in our salaries. So we are looking at if we don't have immediate increments in our salaries, then workers cannot afford to pay for housing tax of 1.5% and the so proposed NHIF tax of 2.75%, and the several taxes that are covered under VAT.
Please increase our salary. That's what we are saying. Because in this country now, anybody with a payslip, he's an enemy. So, and the payslip is being depleted each and every day. So what we are telling the President and the National Assembly, please increase our salary.
That's not going to happen, though, is it?
No, it won't happen.
Sadly.
Yeah, and if it's increased, it will be deducted immediately to something. But just like with housing, I've heard some comments here, somebody saying that our NHIF, our National Health Service, should reach the standards of NHS UK, the United Kingdom. And I like the way we as Kenyans like becoming something piecemeal. On housing, we want to be Singapore. On health, we want to be the UK. And we never accept that there is a totality of things that actually make those countries what they are.
Yeah.
The NHS in the UK doesn't stand on its own without other policies that then support that to be what it is. And when you look at NHIF, this is going to be one of the most sensible conversations this country is going to have. Everybody who has had a patient in hospital, and I've had one as recent as today, we know that you actually need more than this magic payslip the government is looking at. You need a very well-functioning NHIF. You need a national health system that works. You need money in it. And so on that front, that is where the deductions make sense, because they go directly, or they ought to go directly, into making healthcare provision a possibility. But what is the story with NHIF? Why the skepticism that we have even around this desk is because of what it has been converted to be. NHIF is looked at by successive governments, and we should put this as clearly as possible, by successive governments as cash cows. There is always a scramble of who should go to those ministries. Look at the scramble for position of Cabinet Secretary, Ministry of Health. Do you think people are fighting to go there because they're burning with passion to provide health care? Or they really want to fix our sick health provision services? No. People look at things. What is in there? What is NHIF? Where is NHIF? Where is KEMSA? These are the cash cows that have created a lot of rich people in this country. These are facts. And this is why we have those battles. There was a nasty one, I remember, in 2012, I think, under the Grand Coalition government. Very dramatic events at the NHIF. At one point, the board fires the CEO. And the board chair announces that the CEO of NHIF stands fired right now. The vice chair of the same board grabs the microphone in a press conference and says, no, the chair of this board doesn't have the power to fire the CEO. Then down the street, the minister for health, at the time it was Professor Nyang' Nyong'o, then fires both the CEO
board, and the board chair.
And the board chair. And then Harambee House, I think, reinstates one of them. And look at that. And I remember in that whole conversation, nobody spoke about the substance.
Yeah.
It was about who should be there. It should be my person. It should be our person. Because he'll make A, B, C, and D possible for us in terms of the pilfering that happens in some of these institutions. The day we decide as a country to be Singapore on one end, and then now face the NHIF and say, we are fixing NHIF and let it be a national health service provider. Yeah. Remember, it was founded in 1966 when Mzee Jomo Kenyatta, with the mantra of let's fight poverty, disease, and ignorance. Now, to fight disease, there was this department. NHIF used to be a department within the Ministry of Health that was supposed now to make access to health service possible, especially for the poorest, so that nobody out there lacks access to treatment and things like that. Look at how noble that is. Is that what it is doing today? I could call it part-time. And NHIF sometimes does a fantastic job. Yeah. And let's not forget, we've had a lot of good people working for NHIF, and we still do have a lot of good people that work for NHIF. But is politics going to allow NHIF, are politicians going to allow NHIF to be what it's supposed to be? Are they going to allow it to actually spend what they collect entirely and in full on the purpose for which those pennies are collected? Because the problem is, it's a cash cow. Yeah. NHIF, NSSF,
right.
And what was Nyambane's song? It listed
Kila kitu napata.
Everything.
Kila kitu. Until we change that, we are going to be very theoretical about what we intend to be, because NHS in the UK doesn't function this way. You play around with the system, then you'll end up in court. You'll be jailed if you do some of the things that happen at NHIF.
I want to read a message here, and this was shared with me. It was a long message, but I think we have time to just go through it today. And this is about NHIF and this increase from Dr. Oma Oluga. Remember him as a former Secretary General of the Union, also then went on to work at NMS. But this is what he said: with or without the 2.75%, the only way to make NHIF sustainable is to have public facilities offer the range and quality of services that more than 95% of patients need. NHIF must find a way to reverse that skewed ratio of 84% of claims going to private sector and only 16% being paid to the public sector. NHIF must not merely claim it is not their duty. A functional public health service isn't just for providing services, it's also a regulatory barrier for rogue private providers who want to fraud the NHIF. That imbalance of claim payment indicates a structural lack of support for public facilities by NHIF itself. Focusing on the public health system will even change the whole calculation around the cost of providing a bundle or a single service. Remember, we also fund the public system through tax that's appropriated as county budgets and Ministry of Health budgets. NHIF money plus the taxes must be looked at as a continuum of resources available to keep Kenyans healthy. And that for me was just, sort of an interesting thing. And maybe this 2.75% then gives us the chance to really look at how we fund our healthcare in a more holistic manner, because I think we're just usually obsessed with, do we have a problem? Throw money at it. Do we have an issue with this? Let's raise more taxes. But rather, maybe this is an opportunity to have a really good conversation on our public health system as a whole.
And you see, the interesting bit is that even the money that is sent to the counties, remember, health is a devolved function. So majority of that, up to about 40% goes to, close to 70% is for recurrent expenditure, but close to 40% goes to paying salaries. And majority of that, in some counties, actually more than 60% of the wage bill is going to healthcare. Remember, the argument by the government has been that we are doing this to ensure that we achieve the universal health coverage. I just looked up the definition of that by the World Health Organization. UHC means that all people have access to the full range of quality health services they need, when and where they need them, without financial hardship. So it talks about quality healthcare, which is accessible but also affordable. So if we're even to have the 2.75% contribution to the NHIF. I don't know how much that is, but if you're to use what we were told, the 3% of the housing levy was supposed to give the government 108 billion shillings. So 2.75% could be close to that, maybe close to 100 billion shillings. Remember, according to statistics, it indicates that Kenyans use up to 150 billion shillings in out-of-pocket resources for, expenses, paying for medical bills. So here you are, you're talking about provision of healthcare, but what have you done to the quality, for instance? Yes, we may have a number of health facilities, the brick and mortar is there, but have we equipped them with the proper equipment, with the proper testing technology? Do we have sufficient nurses, sufficient doctors, clinical officers, as well as, the whole range of healthcare professionals? So even if you're to increase the money, where are the staff? Where is the quality? And therefore, it's something that we cannot just sit and say, get the money first. So what is the plan? Yeah. And this has been the problem with our governments or the various administrations that we've had, because if you talk about seeking healthcare services, it's not just reporting to a hospital and asking for Piriton. It's more serious than that. Sometimes, especially persons that are living with non-communicable diseases or the chronic illnesses, you need lab tests that are regular. You need to see a specialist. Which one? Where are they? How do you travel to see them? How much does it cost? Will NHIF pay for that? How many specialists do you have? Exactly. The number of specialists that you need. But also sometimes you may need an admission, you may need surgery. So who is to pay for that? So even as we look at all this, it will be important that the program is more holistic than this, so that you bring these healthcare services quality as close as possible to the patient, not the patient having to move from the farthest part of this country, going to Kenyatta National Hospital to find a congested ward, but also a queue that they have to join to wait for their turn.
And as we finish, Yvonne, looking at the deductions and what Gituku is talking about, how it should work for us, these deductions, if they come into force or if they do end up being part of our daily lives, we're talking about how our pay slips would look like come end of July. And the deductions that will come through that. And we were mentioning that there are people who will end up having about 40% of their salaries deducted because of all this, the originals that they had, and include the new ones, including the housing one and the NHIF and all that. And then now, Yvonne, you look at, I think it was, I was asking, and I'm not sure if I'm correct, that there was the Employment Act of 2007, which prohibited employers from deducting more than 2/3 of the basic pay from a worker. But then you realize that, well, other than this statutory and non-statutory deductions, your personal expenses are also going to grow. Because we talked about how the fuel levy is going to go up. You have a loan that you need to be paying back. You are saving to a SACCO. You're taking home less than half of what you earn, Yvonne. And then maybe you had plans to servicing some of the loans that you have shelved, those plans on Aziweka. You're reducing the take home and raising payroll costs for the employers. The government is imposing more deductions on pay slips. This implication is not going to be just harsh for you as an employee, but it's also going to be harsh for the employer. And I listened to the gentleman from Moaso saying, like, having a pay slip is almost like umefanya makosa, unachapwa, unaambiwa kwa nini uko na payslip? Why? Hii payslip uko nayo, wacha tu ikamue vizuri hivyo. And these are the same people who, we keep talking about this tax base. We keep talking about those in the formal sector who are about 3 million or so. They are the same ones that you're taxing again and again and again. And they're the same ones who will end up losing their jobs if the burden is also being felt by the employer, who now has to match up. Where will that money come from? And how will they be able to employ more people? And then now the cost of now doing businesses, the cost of manufacturing and all those things going up. I'm not trying to paint a gloomy picture, but it is the picture that is there, that things are not looking good. That at the end of the month, you're going to katwa pesa zaidi. For instance, let's say 12,000 shillings. For NHIF. Because
if you earn 500,000 shillings, your NHIF contributions will go up from 1,700 to 13,500.
What was the 12,000 shillings doing for you? Maybe you were paying NHIF for a parent. You're paying maybe NHIF.
Out-of-pocket health expenses for them.
Maybe you're paying your water bill. Maybe you're even paying your mother's water bill. Maybe you're paying something else. You're contributing to someone's something. And that is gone.
You're paying a worker.
Yeah, you're actually running the real national health service.
Exactly.
As one person. So that payslip sio yako peke yako. Ni community, communal payslip. And you talked about it last week, Yvonne, what that payslip does.
Yeah. It's going to be huge. All right. You know, you've mentioned something about that role of 2/3. We shall talk about it next week, especially with the constant increase of the central bank rate, and how that usually you get a call from your bank or a text message saying we're now going to increase the cost of your loan. Does that end up to a point where it breaches that 2/3 rule? But that's a story for another day.
Two-thirds majority.
2/3 majority, that's right. Okay, so Jamila, sufanya ile kitu?
Final words, Sijui nani anaanza.